My name is Dr. Deepika Thakur, Assistant Professor, Abhilash University, Chelchok. So the topic for my poster presentation is Successful Management of Uterine Prolapse in a Nulliparous Gaddi Eve, a case report. Uterine prolapse is a serious postpartum emergency in which the uterus completely everts from its position and protrudes out through the vulva following parturition. It is more common in cattle than in case of eves, and if we talk about parity, it is more common in multiparous animals as compared to nulliparous animals. It requires immediate veterinary intervention to prevent any sort of contamination which may lead to any injury or hemorrhage, which ultimately led to the shock or death of the animal. So coming to the predisposing factors, the major predisposing factors are dystocia, either due to enlarged size of fetus or due to multiple fetuses, prolonged, sorry, sir, prolonged labor, or due to excessive traction following during lambing. And due to all these predisposing factors, it led to loss of the uterine tone, which results in ultimately uterine prolapse. So the objective of my poster was to share a successfully managed case of postpartum uterine prolapse in a nulliparous Gaddi Eve. Coming to the case history, a 2-year-old nulliparous Gaddi Eve was presented to Veterinary Clinical Complex, Abhilash University, with the history of mass protruding from the vulva. And based on the history, that mass was protruding 6 hours prior to the presentation after the animal has delivered a dead male lamb. After the prolapsed mass, the animal was showing straining and discomfort for long hours. And when we did the clinical examination, the animal was alert and in standing position, and all the vitals, which includes heart rate, respiration rate, rectal temperature, mucous membrane, and CRT, all vitals were within normal range. And the uterine prolapse was fresh because it was moist, but both the uterine horns, they were completely everted. And the prolapsed mass was having mild edema with no rupture or hemorrhage present on it. Coming to the management of the uterine prolapse, first we restrain the animal in a proper secure position to provide minimum discomfort to the animal. We give the epidural anesthesia to the animal, and after giving epidural anesthesia, we clean the whole of the uterus with the help of diluted KMNO4 solution. And after thorough cleaning, we apply cold application using ice cold water for 30 minutes. And when the edema was subsequently reduced, we lubricated the uterus using the paste of soframycin, lignocaine jelly, and liquid paraffin, so that the uterus, it can be reposed very well in its anatomical position. After proper lubrication, we reposited the uterus back to its anatomical position, and after reposition, we apply horizontal mattress retention suture to prevent reoccurrence of that prolapsed mass. Followed by that, we also give the supportive therapy, which includes the antibiotic, anti-inflammatory drug, or the calcium therapy to gain the uterine tone. As you can see the picture, we have cleaned it with the diluted KMNO4. Then the edema was reduced and it was replaced back, followed by the horizontal mattress suture. Coming to the results in conclusion, the uterus, it was successfully replaced in its anatomical position, and following the treatment, the straining and discomfort was markedly reduced, and the appetite and the behavior of the animal, it resumed normal within few days. The post-operative therapy, it it promoted the uneventful recovery of the animal and satisfactory uterine involution. So at last, they can say that it can be prevented, or preventive measures include preventive periparturient care, balanced nutrition, improved farmer awareness, which may reduce future occurrence of such type of cases. Thank you.
Okay, Dr. Deepika,